Hi everyone, my name's Ashley and I'm a GP, and today I've got a few tips for you to get the best result from wound healing. Now, this information is of a general nature and it definitely doesn't replace the advice of your doctor. So if you have injured yourself, you should definitely see your health professional. So if you've grazed or scratched yourself, or if you've had a procedure which has involved stitches, then maybe some of this information might be useful for you. So number one, keep things clean. This means from the initial injury and throughout the healing process. Infection is a major risk with any break to the skin. Our skin is naturally a good barrier against any foreign bugs from getting in, so we have to be especially careful when that barrier is compromised. Now, when you clean the wound initially, it doesn't have to be anything fancy. You just want to make sure any visible dirt or foreign material is gently wiped away. So usually we would use normal saline, which is sterile salt water, which acts as a really good antibacterial. You can use half a teaspoon of salt in a cup of water, ideally cooled boiled water, and that does a similar trick. Things like peroxide, alcohol, and methylated spirits are a big no-no. Even betadine can dry out the wound a bit too much and cause a bit of irritation. And after cleaning, keeping the wound covered with a simple dressing is a good way to keep the bugs out. For most simple wounds, showering with the wound open is a simple way of keeping things clean. Just make sure the area is dry completely and covered with an appropriate bandage afterwards. Number two, keep things moist. Now, it's a bit of a myth to let wounds dry out. When that happens, a scab forms and it just slows down wound healing. So for most wounds, a moist environment is best, so not too dry and not too wet. Again, keeping a dressing or a bandage on helps achieve a good environment for wound healing. You can add things like hydrogels or paraffin-based products to add a bit more moisture as well. In areas where it's hard to apply a dressing, like the scalp or the face, using an ointment such as soft paraffin, pawpaw or Vaseline can be a good alternative. It helps both add moisture to the wound and it acts as a physical barrier against any bacteria. After it's healed, regular moisturiser to the area will help the skin stay healthy and minimise any scarring. The third tip is keeping it protected from the sun. Healing skin is less robust than normal skin, so it's a lot more sensitive to the UV radiation from the sun. The cells that provide pigment to the skin are also more exposed, so sun exposure to that area can lead to excessive darkening of the scar, and that can be a permanent thing. Again, covering the wound with a dressing can help with this. And the usual sun protection measures like wearing a hat, covering up with clothes, using sunscreen is all essential too. So a bonus tip for those who might have had stitches out recently, you can optimise healing of the scar by using a surgical tape for a further few weeks. There are a few different brands out there. A common one is called Hyperfix, so it looks something like this. It's basically a breathable sticky tape that can be applied directly to the scar. You can get it wet, it protects against physical damage and also against UV radiation from the sun too. You can replace it once a week or whenever it gets a bit grubby. It just provides a really good environment for the scar to heal in. So there you have it. They're my few tips to get the best result from any wound that you might have and to debunk any myths about wound care. So if you enjoyed this video, please give us a like, subscribe to see more videos. You can follow us on Instagram and we'll see you in the next video. Hopefully Laurie will be there too.